September is National Pain Awareness Month. Pain is associated with a wide range of injury and disease, and is sometimes the disease itself. More than 1 in 10 American adults suffer from chronic pain, and for some of them, even the simplest everyday tasks can be difficult. Here to discuss chronic pain is pain specialist Dr. Sunil Panchal. Good morning, doctor.
Good morning.
Just what is chronic pain, and what are some of the diseases associated with it?
Pain that lasts beyond the time period you expect from any particular injury. So people will develop pain that will continue after surgery. They may have pain that will continue after any kind of chronic disease, for example, arthritis, commonly occurring, and one of the most common reasons why people have neck pain or back pain or pain from the major joints.
What are the challenges faced when diagnosing chronic pain?
One of the main issues is to identify treatment goals with the individual and make sure that they have a clear understanding what are the pros and cons, whether you're using medication therapy or procedural or surgical therapy.
What are some effective ways to treat chronic pain?
We have two major categories of how we define therapy. One is on the medication standpoint, and then one is on the procedural standpoint. So on the medication standpoint, one of the options that we have, we're using medication that slow down the nerve signals, and so we use classically anti-seizure drugs, which will slow those signals down and will reduce pain, and they're safe for chronic use. There's been a lot of controversy about the use of opioids, and we are learning more issues about opioids in terms of osteoporosis being accelerated, and there's several animal studies showing that cancer metastasizes faster in the presence of opioids. So the concepts of what we do from drug therapy has evolved. And then on the procedural side, we have technologies such as radiofrequency ablations, where we can essentially cauterize the nerve supply to the major joints of the spine or hips or knees to relieve pain on a long-term basis. We have other technologies such as spinal cord stimulators, which there have been advances significantly in the past year, where we now can do high-frequency stimulation, or we can also power the system wirelessly so patients can still get MRI scans. So there's a lot of advances in that regard.
What are some of the burdens that people with chronic pain face every day?
Patients will have, depending on the severity of their condition, they may have limitations in terms of their normal function or interference with their ability to perform work in their employment capacity. And so and then when you're trying to treat their symptoms, sometimes medications that they're being treated with have their own side effects that are that have to be dealt with, or impede memory or alertness. So those are some of the issues that they commonly deal with.
How does chronic pain affect relationships and or the family unit?
In some scenarios, the families become closer as the family members do try to help that individual cope with their condition. In some scenarios, the burden of dealing with the condition drives family members away, and it may impair the relationship with their family members.
Where can people go for more information on chronic pain?
There's several organizations, such as the American Academy of Pain Medicine, that has resources available. The American Society of Interventional Pain Physicians also has resources and knowledge available for the patients.
I would like to thank you for sharing information on chronic pain with our listeners, and have a great day.